Hello again, everybody. Today we're going to do a lecture on microorganisms of the urinary tract. Now, the actual topic is the genitourinary tract. But these are two distinct organ systems. And I'm going to break it up into the two portions, the urinary tract and the genital tract. And you'll get it in two portions because I feel that if I do it all at once, it's going to be too long a lecture. So I'll break it up into these two parts. We'll do the urinary tract first, and then we will do the genital tract. All right? So let's talk a little bit about the urinary tract. And if you remember from your A&P, in line with everything else, we talk a little bit about the anatomy. And the urinary tract will have, making up that tract is the kidney, the ureters, the bladder, and the urethra. I have a picture here for you that I took from your lecture textbook. And there you have the kidneys, those bean-shaped organs there. And then you have these two tubules that's leading from the kidney into the urinary bladder. Those are your ureters. And then, of course, you have your bladder in which the urine is kind of stored, collected, and stored there for a while until you have the urge to urinate. And then the urine will flow through the urethra to the outside. Now, any one of these areas, we'll find out later on, can be infected. And you can have in any one of those areas urinary tract infections. But we'll talk a little bit more about that. Let's now talk a little bit about the defenses. In line with everything else that we do, we talk about the anatomy first, and then the defenses. Now, for the urinary tract, one of the major defense is the actual outward flow of urine. And that's flushing organisms out of the system. The urinary process itself, the flow, also encourages desquamation of the epithelial cells that are lining the urinary tract. And these will also shed microbes with those cells. Not a bad thing. Remember what we said about desquamation on the upper layer of the epidermis, the very top layer, that's constantly shedding. And you want that to happen because if organisms land there by means of the shedding process, organisms, you're not only shedding the cells, but the organisms that land on those cells. Same thing with the urinary tract. If you are urinating some of those epithelial cells that may have some organisms of them, if they're shedding and flowing out with the urine, you are getting rid of microorganisms that way too. You will learn later on that some of your normal flora are the major threat to urinary tract infections. One of the defenses, I should say, is that the cells that are lining the urinary tract have different chemicals on their surfaces than those of the gastrointestinal tract. And so those organisms that are adapted to adhere to the cells of the gastrointestinal tract cannot really attach to the urinary epithelium. And hence, that's a deterrent for the organisms to stay in the urinary tract. Okay, why is that important? Well, we'll learn later on that most of those normal, what we call normal flora of the GI tract, the gastrointestinal tract, are going to be the pathogens of the urinary tract. So if you can say that organisms of the GI tract are not adapted to attach to the urinary cells, the cells of the urinary tract, then that would be a good thing. All right, physiological differences. Well, of course, we have urine, and urine has a slightly acidic pH, not slightly acidic. Urine is in general acidic. It also has lysozymes. We learned earlier in other lectures that lysozymes can break down peptidoglycan, which is the cell wall structure of bacteria. That's a bad thing for the bacteria, so it must be good for us. Lactoferrin also inhibit bacterial growth. And then we talked about all of these. Secretory immunoglobulin A, which is specific for previously encountered organisms and tries to get rid of them. And also your IgA is something that helps to preserve the tract itself, mucous lining of the tract. We also have some normal flora, but in general, should make this very clear right now, that the kidneys, the ureters, the bladder, and even the upper urethra should not have any organisms at all. Because what are we having in the urinary tract? What is in the urinary tract? Why is it there? Well, if you remember, we're filtering the blood. The kidneys are filtering the blood of waste products of metabolism. In a normal, healthy individual, the blood is not supposed to have any organisms, and hence, what's being filtered should not have any organisms either. But it is true that the urethral opening is a portal of exit, can be a portal of entry. And so, yes, we will need some microorganisms at the tip of the urethra. And many times you'll have organisms like non-hemolytic strep, some staphylococcus, corynebacterium, lactobacillus. Okay, you find that also in the vaginal tract. We'll talk about that later on when we do the genital organisms. But yes, if you're going to find it in the vaginal tract, those organisms, they are going to be at the tip of the urethra too. So these are your normal flora. Another thing that you should know is that the female urethra is quite short in comparison with the male urethra. And because of the proximity, that urethral opening could be a pipeline for gastrointestinal organisms from the anal opening contaminating the urethral opening. And that happens a lot in females especially. The penis is usually colonized with aerobic Pseudomonas and staph species. In an uncircumcised penis, sometimes you have that foreskin that's there. And it is an area where not much air is going into that area. And you can have sometimes anaerobic gram-negative rods colonizing there. They can actually be problematic later on. We said that the flushing action of urine will help to keep infections of the urinary tract to a minimum. But we have to understand that urine in itself is a very good growth medium. That will become important when we try to diagnose urinary tract infections. We'll talk a little bit about it in the lab. We still have a couple of labs before we get to that. But when we do urine cultures in the lab, there is a need to know this kind of info because handling specimens become very important. Now, I did say up and down the urinary tract, you can have infections just about anywhere. Infections of the kidney itself, pyelonephritis. Sometimes you can hear about glomerulonephritis or even nephritis in itself. Kidney, inflammation. And then, of course, the ureters can also be infected. I don't have it here, but ureteritis is possible. Cystitis is infection of the urinary bladder. And of course, urethritis, infections of the urethra. We're not going to talk much about urethritis when we do the urinary tract infections, but we will deal a lot about urethritis when we do genital and sexually transmitted diseases. All right, some symptoms. Symptoms will vary depending on the location of the problem. And most of the time, it's going to be cystitis, which is the urinary bladder involved. The symptoms for anybody who has ever had a urinary tract infection will know this. And it is very common, especially in females. Sometime in their lifetime, in a female's lifetime, she will have a urinary tract infection. I don't know if I want to say that about males, but they do generally have urinary tract infections also. But females, it's really very common. And if you haven't gotten one yet, it's not something you want to wait out for, but expect it. It should be coming. Now, cystitis, usually you'll end up with some pain. But one of the biggest problems there, you want to go urinate all the time. Frequency, they call it. And even when the bladder is empty, you still want to go. You have that urge to go. It's almost like the bladder is telling you, something is here that I don't want. Get rid of it and try to flush it out. Dysuria, a little burning pain accompanying urination, or sometimes difficulty urinating. Now, cloudiness in the urine, I'm not going to say it's all the time going to be indicative of a urinary tract infection, like cystitis. However, it is when the urine is cloudy, it could be an indication that you have bacteria in there or white cells in there. Remember, when you have bacteria growing anywhere, one of the, especially liquid medium, one of the things that you're going to look at is turbidity. So if it looks a little cloudy, chances are you might have bacteria in there or white cells. Remember, whenever you're infected with anything, white cells will come into play. And so lots of white cells will cause the urine to look a little cloudy too. The other thing that I want to mention that's not in your slide is that sometimes immediately after a meal, you can have cloudy urine in a normal, healthy individual, or sometimes immediately after exercising. You're just in the gym, and before you leave the gym, you urinate. It might look a little cloudy. So cloudiness, I'm going to put an asterisk there because it's not always an indication that it's a urinary tract infection. Hematuria, though, presence of blood in the urine, is definitely reasons to concern yourself. Low-grade fever and nausea sometimes could be an indication of a urinary tract infection also. Now, for pyelonephritis or for the kidney involvement, generally going to have more of a fever and definitely some back pain, lower back pain. And a lot of times, if you have a lower back pain, chances are the doctor will do some different testing, maybe do some x-rays and check out the lower back for kidney problems. And you don't want, because if you don't pay attention to that, you could end up with permanent damage to the kidney. And you don't want to go on dialysis. That's not one of the things you should be looking forward to. All right. Acute uncomplicated UTI, usually only the bladder is involved. And so you can treat that without a problem. Some causative agents. Now, I mentioned that the urinary tract, most of it, except for the lower urethra, where you have your normal flora, should really be free of microorganisms. Now, we have something called the microbiome project. Your book goes on and on about the microbiome project. And that seems to be contradicting everything that we say about everywhere. And they seem to want to claim that there are some organisms that are in the upper urinary tract. Possibly, I would say they're like not, maybe not there permanently, but maybe transient. Okay, so I wouldn't go too much into that. But if you think about it, just like we think about the fetus and wonder where are those organisms coming from, when the fetus is just getting nutrients from the mother, the same thing. We're filtering blood that has nothing in it, no organisms, that is. You're just filtering some metabolic waste. So you shouldn't see any organisms in the urinary tract except for the lower opening. And we need those there as normal flora. But 95% of your urinary tract organisms are actually normal flora of the gastrointestinal tract. And I cannot impress upon you how important that is. Because of that, it is very important for you to understand how easy it is to contaminate yourself. So a lot of times, it's not a matter of, you doing anything wrong, but contaminating yourself. And, as I'm talking to you, I just realized that we did not put a slide there on how you acquire these diseases. And maybe in the lab, I'll make sure that I have a slide on how you acquire urinary tract infection. So I'm going to make a note for myself right now so I don't forget about it. But like I said, one of the ways to acquire the urinary tract infection is self-contamination. You go to the toilet and you don't clean yourself properly, or you clean it the wrong way, and you actually contaminate the urethral opening with organisms of the anal opening. And feces, a large percentage of feces is really microorganisms. All right, so it's not unusual to contaminate yourself with GI tract organisms. What do we find most in the GI tract that will cause your problem is E. coli. A lot of the urinary tract infections that when we cultivate in the lab, we're going to end up with E. coli. Next in abundance is actually Enterococcus faecalis. And then you're going to have some Staph saprophyticus and some of the other organisms there. But a lot of times you're going to have the gram-negative rods, E. coli and Enterobacter and Klebsiella. Things like Proteus, Pseudomonas. Those gram-negative rods, you get a lot in the urine, causing urinary tract infections. Okay. Now, how are they transmitted? Well, urinary tract infections, your book tries to differentiate or to separate community-acquired urinary tract infections or UTIs from those that are hospital acquired. Okay, and we are going to talk a little bit about them. Community acquired UTI, usually not transmitted from person to person, like I said, except sometimes during sexual intercourse, or if you're inserting anything in the urinary tract. Okay, most of the time, women more than men, because of the nearness of the urethral opening to the anus, it will be contaminating yourself. In women especially, there's something called the recurrent urinary tract infections. You could have a urinary tract infection and treat for it, but sometimes what happens, some of your E. coli can invade the deeper tissue of the urinary tract and avoid being killed by the antibiotics. These are the same organisms that will come back later on, will reemerge from where they're hiding and will cause the symptoms again. Not that you reinfect yourself, but the same organism. You have like a relapse of the same thing. Now, catheter-associated urinary tract infection is a very common way of acquiring the organism. In a clinical setting, many times patients go into the hospital maybe for surgery or for some other problems. And let's say they're going in for surgery. 10 out of 10 times, all the time, regardless of how short the surgery is going to be, they are going to insert a urinary catheter, because if you are going to be on the operating table, doctors are not going to wake you up because your bladder is filled to go to the bathroom. No, they will have a urinary catheter inserted, usually a Foley catheter that's inserted, a tube that's inserted into the bladder to drain the urine. And when you're out of the operating room and you're recovering and everything is okay, they will take the catheter out and you'll be okay again. There are many times that patients stay for longer periods of time in the hospital. And sometimes patients just cannot on their own go to the bathroom. And so a urinary catheter is usually in place. Now, nothing is wrong with that, except that if you don't take care of the urinary catheter, if you don't maintain it properly, it's one of the most common causes of UTIs in a hospital setting, what they call nosocomial UTI, catheter-associated UTI, or CAUTI, C-A-U-T-I, they call it. Okay? Sometimes if you're not careful and you're not even inserting the catheter carefully, you can contaminate. And remember, this is going straight into the bladder. You can contaminate the bladder that way. But most of the time, you could be doing a good job inserting the catheter, but if it's not maintained properly, you being nurses or going to be nurses will be trained as to how long you can put the catheter in and let it stay there, how often you have to change it, how often you have to go and make sure that you clean the tubings and whatnot. I'm not a nurse, so I'm not familiar with all the intricacies of maintaining the catheter. But I've done a lot of work, a lot of research on UTIs in a hospital setting and realized that almost 10% of the patient that has a catheter inserted will end up with a urinary tract infection. And if care is not taken as to how you care for those patients, they could end up even losing the kidney. Nowadays, there's I should mention this, hospitals are being penalized. There's a new ruling that says if the patient contracts certain diseases in the hospital, insurance is not going to pay for it. the hospital is going to have to, absorb those costs to treat the patient. They have to treat the patient, but they're not going to be reimbursed for that treatment. So they have to absorb the cost themselves. All that in an effort to make sure that the hospitals are doing the right thing. Okay. Treatment for urinary tract infections? Well, like everything else, you can use antibiotics if it's bacterial, but you could have urinary tract infection due to fungus, so you'll end up with antifungal drugs or some protozoa. Not very often, but you need antiprotozoan drug for those, and so on and so forth. But most of the time it's bacterial, and so we'll use antibiotics. Sulfur drugs like trimethoprim, sulfamethoxazole, you probably know something we call Bactrim. Very good for urinary tract infections because you need something that will kind of delay in the, remember the urinary tract fluid, the urine is constantly dripping into the bladder. So you need something that will stay for a little while to make sure that you need to kill the organism, so you're not washing away the antibiotic immediately. So Bactrim, sulfur drugs are generally very good for urinary tract infection. Now there are non-antibiotic drugs, which is they call pyridium. And pyridium, sometimes the doctors will not prescribe, but will ask the patient to take that. And many times it's done at the same time. What pyridium does really is to relieve that uncomfortable feeling, the burning sensation and that uncomfortable feeling of urgency all the time. Now, pyridium is really an azo dye. And when you use that, it will make the urine turn red or a dark orange color. And that's not a very good thing because if, say, your urinary tract infection is getting worse, one of the things that will be in the urine, one of the symptoms that we saw, is blood in the urine. If you're using this pyridium, this azo dye, that will mask any blood that's in the urine. So maybe you can use it for a couple of days, but not too much longer. And then, stop the use so you can see where the infection is going. A lot of the times, the book talks about E. coli is usually sensitive to penicillin. I'm sorry, E. coli is usually resistant to penicillin. They're generally sensitive to ampicillin, though, but they still don't use them because it is one of those penicillin type drugs. So we don't want to treat because they become very resistant to those drugs. Your book talks a little bit about a disease called leptospirosis. Now, leptospirosis is a really urinary tract pathogen most of the time. And what's going on here is that you're contaminating yourself with an organism that's really a pathogen of pet animal, domesticated animal. This organism is usually found in the urine of these animals. But when you infect yourself with this organism, you can end up with damage to the kidney, the liver, the brain, and many other areas. And your book talks about it, and I think for maybe two reasons. One, more and more people are having pets in their homes. Well, a cat, most of the time it's the cat, cats and dogs, domesticated animals. And the other reason is that sometimes you have this organism contaminating your pools. One of the biggest issues, and your book mentioned it too, was a while ago, I think maybe 2 decades or so ago now. When was it? In mm, 2008 or something like that. I think maybe it's 2008, 19, I'm sorry, 1998. That's a longer time than I thought it was. A lot of athletes, dozens of athletes got sick because they were swimming in contaminated water, and they contracted leptospirosis from the water itself. And so it became notorious for that. So anytime they talk about swimming pools, Olympic swimming pools and water, that comes to mind very easily. Now, the causative agent is something called leptospira interrogans. And there are many different serotypes of it. But like I said, it causes leptospirosis in humans and also in some animals. But it seems to be more of I will say, a commensal in your pet animals, but you still don't want them there. I would assume that every time you take your pet to the vet, they'll probably be checking out for leptospira organisms. Usually transmission occurs entirely through contact with skin abrasions, mucous membranes, but it's always with animal urine, rarely environmental source. But even the environment contaminated with urine first. All right. So I think treatment for leptospirosis, amoxicillin, doxycycline, and regular antibiotic. But like some of the other diseases we'll talk about when we talk about syphilis and some other spirochete diseases, or early treatment is always better. If you delay the treatment, somehow the antibiotic is not as effective. It's almost like your body is not going to respond as well. All right, so it's always good to have early treatment, abrupt treatment, and sometimes you need aggressive treatment. All right, folks. I didn't want to add that to the sexually transmitted and the genital diseases, because even though it may not be that long of a topic, I don't know how many minutes, but it is still something that we can do separately from the genital organisms. Okay, so I'm going to stop the recording and we'll continue with this later on.